Central Serous Retinopathy, otherwise shortly known as CSR, is a retinal pathology and where there will be fluid accumulation in the central part of the retina. So it is very common nowadays, and the main symptoms are one, central blurriness of the vision. It will be developed all of a sudden or gradually also, and the symptom is mainly blurring of vision. One, more seriously in the central area. Peripheral will be sometimes better, much better than central. The second symptom is distortion of the objects. Distortion means the size or shape will be distorted. For example, if it is a straight line, it will be seen as zigzag or wavy like. That may be both in vertical or and horizontal lines. That is one main symptom. And then if it is chronic or serious, then that central area will be totally blocked, not blurred, it will be dark and totally blocked area. So the patient may not be able to read properly through that area, or if we face a patient or an object, that focusing point may be missing. That will be black only, not so he'll have to twist his head to get the clear view. This is the main symptoms of CSR, and the reason is accumulation of fluids in the central area of the retina, especially the macular area. So these symptoms are due to this accumulation of fluid. So if we have to control or eliminate this distorted vision, that fluid accumulation should be removed. The fluid accumulation is due to the leakage from the vessel. There is no other way to get the fluid. So it is a leakage from the vessels. It may be a direct leakage from the vessels or also the encroachment of the blood vessels to that area where it is supposed to be avascular. That also will become a reason indirectly. So to control this CSR or this distorted vision actually means to maintain the circulation and to drain out the accumulated fluid. So the treatment will be in two steps. One is to maintain or to control the root cause, that is the defect in the circulation or the vasculature. Second is to drain out the accumulated fluid from the retinal layers. This should be done in two separate sections. If so, we can avoid further complications or recurrence. Usually if it is very mild, if the condition is mild only, not so serious, then there is a possibility of absorption of this accumulated fluid by itself according to the body mechanism. Any small things will be maintained by the body itself. There is a defective or a defense mechanism in the body for whatever disease it may be. So it will control it, and the fluid accumulated will be reabsorbed to the vessel system. If it is, but the root cause is remaining, if so, recurrence is very common. If the root cause or the causative etiological factors are coming again, it will recur again. What are the etiological factors? One is the poor circulatory system, and main thing is this stress or overtension or overstress. So itself it is very common nowadays. There is nobody now in the cell from starting from the LKG or small kid, they are under stress or under tension. So the incidence of this condition is very common, and its rate is very high nowadays. So this can be controlled by two methods. One is by this maintaining the circulation, and secondly by removing the accumulated fluid. For this aim, there are different types of medicines and treatment procedures, I mean therapies in Ayurveda. I don't know how much common people are aware of it. The treatment procedures like Shirodhara, Netra Tarpanam, etc. are very much effective in this situation. But these are the only name of the procedures. The actual result or outcome is from the medicines used for this disease and the indications for each procedure. In Ayurveda, the equal importance is given for both these medicines and the treatment procedures. For one disease, not only the medicine is important, also the mode of application, that is treatment procedure. Both are equally important. So we have to select the medicine and also select the mode of application. Different mode of applications are there in for ophthalmic and non-ophthalmic medications. The selection should come from an expert hand only. If you are doing this appropriate treatment procedure with the suitable medicines, result is very high. We can avoid further laser and other treatments and also recurrence of the disease further. That is possible.